So we all know we are supposed to exercise, but study after study shows that the vast majority of us aren't doing it. And study after study also shows that exercise for cancer patients and survivors is even more important for them than it is for the general population. But even knowing that, cancer survivors tend to exercise even less than the general population that isn't exercising enough. And considering exercise in people with a history of cancer improves quality of life, length of life, and improves life expectancy, we've got a problem. I'm cancer physical therapist Dr. Leslie Waltke. Welcome to the Recovery Room's video series on the ABCs of exercise. One of the biggest barriers to exercise in cancer survivors is just not knowing. Not knowing what to do, how to do, when to do, how much to do, or what kind to do. What's okay, what's not okay, and can I hurt myself? Those are all very fair questions. More fair questions about exercise. What if you're still in treatment, weak from treatment, or still have cancer in your body? What if you have fluid in your lungs or maybe have metastatic disease? What if maybe you're overweight and were maybe out of shape since way before your cancer diagnosis and treatment? And what happens if you don't have a nearby gym or live somewhere where it's too hot or too cold, or live in the middle of nowhere, or in a neighborhood it's too dangerous to walk outside? When it comes to exercise during and after cancer treatment, people rightfully are scared and confused. Yet, the unfortunate part of the not knowing is it just drives people to avoid moving and exercise. And unfortunately, this not moving leads to more fatigue and weakness. More fatigue and weakness leads to less exercise and moving and shutting down. So it just becomes a vicious cycle, leading to a very negative impact on both health and quality of life. And because exercise is so important, if you have ever heard me talk before, you are probably familiar with my common saying, exercise like your life depends on it, because it does. So let's define exercise. Basically, it's just intentional movement. Movement with the intent of making a body part function better, or stronger, or be more flexible. Exercise comes in one of four general purposes. Aerobic exercise, which is for our heart, lungs, circulatory system, and brain. Strength exercise, also called resistive exercise, is for our bones, muscles, tendons, and ligaments. Balance exercise, which is critical to us maintaining walking and daily routine functions. And flexibility exercise, which maintains the ability of our joints and muscles to move and function normally, so we can move and function normally. So point number one of this ABC lesson is exercise does not have to be complicated. Taking a walk is exercise. Standing on one leg is exercise. Point number two, there is a difference between being active and doing exercise. Mopping, raking, cooking, and cleaning is being active. This is good, but it does not and cannot replace exercise. Remember, exercise is intentional movement. Point number three, if you're in too much pain, too weak, or too tired to exercise, chances are these are signs you need to exercise. Thank you for joining me for episode 1 of the Recovery Room's ABCs of Exercise After Cancer. Here it comes. I'm Dr. Leslie Waltke. Exercise like your life depends on it, because it does. And stay tuned for lots more exercise information to come.